in the coming days, having been 48 days now since the first positive coronavirus case was reported in the country. Thank you for joining us. But first, 24 hours after news broke on government expenditure in fighting COVID-19, Kenyans still await straight answers on the issue that has sparked raging public debate. This comes as 12 more positive cases are reported, with the total Kenyan tally of COVID-19 now at 396.
At the end of April 2020, Kenya says it is making progress in combating COVID-19. Over the past 24 hours, Kenya has seen the largest COVID-19 recoveries so far.
We have been able to record 15 new discharges. This now brings to 144 the total number of recoveries.
At the same time, Kenya says it now has a total of 396 COVID-19 cases. This happening as it upped testing from 508 the previous day to 777.
Out of these, 12 people have tested positive for coronavirus. 7 of these are from Mombasa, 3 from Nairobi, 1 from Wajir, and 1 from Kitui.
Now, media reports on government expenditure for COVID-19 have generated heat, raising transparency and accountability queries. Among expenditure that has raised eyebrows include 2 million shillings utilized out of 6 million shillings set aside for airtime. Remember, there was a separate 70 million shillings also set aside and supposedly utilized for communication. Then there was 11.8 million shillings utilized for a call center out of 11.8 million shillings set aside. And then there was 12 million shillings spent out of 13.5 million shillings set aside for accommodation of healthcare workers. On Thursday, government could only confirm knowledge of these concerns.
On this matter, our accounting team, together with our international partners, will issue a detailed report soon.
The government could also not give straight answers on amounts spent by the government so far on treating COVID-19 patients, critical, moderate or mild. Government has made it clear that if quarantined, Kenyans will meet their own cost.
Of all these 210, 208 of them are in stable condition. It's only 2 who are in a critical condition on ventilatory support, but one of them is also improving.
Mass testing for COVID-19 will kick off on Friday in Kawangware, a Nairobi neighborhood named among COVID-19 hotspots. While Kenyans expected the government to give answers on key accountability issues such as expenditure over the COVID-19 pandemic, government